Hey guys, so in this video, we're going to be talking about what your agency can actually give to discharge planners and social workers. This is one of the biggest topics that we have to answer a lot for a lot of our clients and a lot of people that make questions in our videos. And so we're going to be tackling that information at this very moment. So pay close attention because this is probably one of the most important things you should know, or you should probably let other people watch who are marketing or who is managing your agency, okay? It is important, so pay close attention. One of the biggest questions, right, is this. When I go out there consulting, it's, hey, Michael, what can we give discharge planners? I always get to ask that question. Discharge planners, case managers, and social workers, they're like pretty much all the same. They do all the work, same work pretty much. Now, they certainly cannot accept cash payments from providers, home health agencies, or hospice in exchange for referrals of patients. Okay? Now, what about non-cash items that have a relatively low value? Is that okay? And that providers who receive referrals are not obligated to provide to case managers, right? Can case managers accept such items? One of the key areas that we need to consider to be able to answer these questions involves the federal statute that pretty much prohibits illegal remuneration or kickbacks and rebates in Medicare and Medicaid and other federal and state healthcare programs. This federal statute makes it a crime for any provider to offer or to give or to actually give anything to anyone in order to be able to induce those referrals. Providers that are not Medicare certified or are not participating in the Medicare program, such as private duty home care agencies, may be tempted to ignore this statute. Now, providers, you need to remember this, and you must remember that the fraud prohibition also applies to companies that applies to the Medicaid program, including Medicaid waiver programs, as well as any other federal, state healthcare programs. So home care is included in that. To add to that, even if those providers who do not accept payments from federal or health state programs, the case managers, those discharge planners, those social workers where the patients are coming from, those people work for organizations that do accept it, right? So they need to comply with fraud and abuse prohibition, and providers should assist them to do so. You do not want to cause people that are referring patients to you to commit fraud. That is your job. It's your obligation. You would not want anyone to make you commit fraud, right? Without you knowing it. We need to do the same thing, and we need to educate them about this. These case managers, these social workers, these discharge planners that are actually violating this or have violated the federal statute may be guilty of criminal conduct and might go to jail or be forced to pay a large amount of money in the forms of fine or civil monetary penalties. They can actually be excluded in participating in Medicare and Medicaid programs. Can you believe that? If case managers are licensed, they're also facing the chance of losing their licensure with that state. The OIG, right? The U.S. Health and Department of Human Services, the primary enforcer of fraud and abuse and prohibition, they've stated that regulations will be published that will help define what items or not monetary value may be accepted from providers who receive referrals. Until those specific guidelines on this issues is provided by the OIG, we as providers, them as case managers and social workers, must be smart and wise to make sure that we pay attention and do not violate the anti-kickback laws, the Stark laws. Even the Stark laws technically only applies to physicians and providers who render designated health services. DHS generally includes home health and home medical equipments into this whole thing. So you have to be very careful. And yes, also hospice companies as well. Specifically, let's talk about the Stark regulations. The Stark regulations have said that any free item of relatively low monetary value are unlikely to cause overutilizations. It provided with reasonable limits the regulations for the state as long as all of the following criteria is met. So I want you to pay attention to these criteria. As long as all of these criteria are met, such non-monetary compensations will not, let me repeat that, will not violate the Stark's law. So let's go ahead and get started talking about this. Providers who give non-monetary compensation must make it available to those similarly situated, regardless of whether they refer patients to the provider for services. The compensation is not determined in any way that takes into account the volume or the value of referrals to the provider. So if you're giving chocolates or Hershey Kisses to one person and you're giving baskets to another, you don't want to be able to do this. You have to be fair all throughout. The annual aggregate value of non-monetary gifts should not, will not, and definitely will ever exceed $359, and this is as of 2010 of November, okay? You have to understand that providers and case managers should also be aware of the following limitations under the Stark's Law. Protection from violation of the Stark's Law is not available for gifts that are solicited. The exception for non-monetary compensation of up to $359 only protects gifts to individuals. Now, in theory, providers and those case managers can comply with the requirements of the Stark's Law regarding non-monetary compensation to physicians, but they still violate the kickback and rebate statutes that we talked earlier on. So pay attention to that. At this point, however, it may seem unlikely that the OIG will conclude that the case manager received kickbacks and rebates. If the requirement of the Stark regulation described that I've been sharing with you guys right now, as long as it's met. So in other words, compliance with the requirements of the final Stark regulations will and actually can provide protection to these case managers and the providers with regard to non-monetary compensations that is received from providers by these case managers, even though they may not technically apply. Now, I want you to understand that temptations is out there, and that if we succumb to these temptations, there is a great deal that can be lost. Your time, your money can be lost, your license, your company's business. So be careful and pay attention and know the law and keep yourself updated. So pretty much, I hope that you guys paid attention to this video. We're going to be having more videos in regards to the Stark's Law and anti-kickback laws as well, because our goal is to make sure that you guys are well informed and not messing up. So always understand that home health marketing is easy when you know what you're doing.